The Catholic Church Health Services has spoken out on the national government's slow release of funds that has affected salaries and operations. National Secretary Justine McMahon told EMTV News that health workers have worked without pay for over 2 months and called on the national government to meet its commitment.
But the salaries and operational grants have not been released yet for July, and we're now in the second week of September. So they don't have them for September either. So as you can imagine, this causes very big stress for the health staff and for the running of health facilities.
There's urgent need for the national government to release funds to churches to continue operating, says Executive Director Sister Tasia Handhoff. And if billions of kina were spent on sports and infrastructure in the capital city, it's fair enough priority areas are considered first.
And help them in their needs, because especially in this time of drought now, I remember so well from the previous one how people really suffered in the rural areas. And again, this time it's again the same areas who are affected than it was previously. So I think the government would have an obligation to really look into this.
Like other churches, the Catholic Church already highly subsidizes healthcare services. It recognizes that the staff are professionals with financial commitments who cannot afford to work with no pay.
In my early years in the Highlands, if this would come up that the funds would not be available, people would, from their own, would bring food and garden fresh greens to the nurses to help them over this difficult period. But now people themselves have no food. So how can they support their nurses and their doctors in their rural health service?
Even before Waigani and after Waigani, the Catholic Church has been continuously providing the much needed services, now partnering with other churches to bring the service where there is no government presence. What they want is for the national government to quickly intervene, to release funds on time so that people can continue to access the service. Faven Hakelitz, National EMTV News.